With so many San Diegans losing their jobs, there are a huge number of questions. What about rent? What about food?
For some, the biggest question is, what about health insurance? NBC7's consumer Bob looked for some answers.
Losing a paycheck can be devastating to a family, but it can be a short-term problem. Losing your health insurance, that can be a long-term problem, but there are things you can do to keep your coverage. In this season of coronavirus, we've been focusing our attention on our health, and for many, that includes their health insurance.
Half my time is being a therapist, trying to educate and teach them and say, it's not that bad. We can find something that will work for you. Don't freak out.
That's health insurance agent Craig Gusson. He says every day, people are asking him what they should do if they lose their job.
If you're furloughed, you can still stay on the company's health insurance. If you're laid off, you cannot.
But Gusson says furloughed employees still have to pay their portion of their insurance coverage. If you're laid off, COBRA is an effective but expensive way to continue your original health plan for up to 36 months. Medi-Cal is an inexpensive option for someone making less than $17,000 or less than $35,000 for a family of 4. And then there's Covered California.
Covered California has a special enrollment period through June 30th, that pretty much anybody can sign up for.
Covered California subsidizes your monthly premiums based on your current income, including unemployment.
In most of the situations we run into, it's always cheaper Covered California, except you have the risk.
The risk Craig is talking about is if you get your old job back or you get a new job and your income goes up. At that point, you no longer qualify for the subsidy you were getting.
So Covered California is going to send them a letter, actually the state is, saying that you shouldn't have received the subsidies for those months. You owe us that money back.
But that should not keep you from getting health insurance. Gusson says you need to do your research or talk to a health insurance agent.
For the person who doesn't go to the doctor a lot, it's really easy. But for the person with a medical condition, a family, some health issues at all, a prescription issue, yes, it's a bigger deal.
And for people 65 and older who lose their job, Medicare is also an option. For NBC7 Responds, I'm Consumer Bob. Back to you.
By one estimate, nearly 4 million Californians have lost employer-based health coverage since March.